Good afternoon, and welcome to today's DHHS Inclusion Works Lunch and Learn. Before we get started, here are a few reminders about the webinar. Please make sure you're using a computer or smartphone connected to the internet and the audio function is on and the volume is turned up. Please be sure your microphone is muted for the duration of the call unless you are speaking or asking questions. To ask questions, use the chat feature or click the hand icon located on your control panel, and we will answer as many questions as time allows after the presentation. For closed captioning options, select the closed caption feature located on your control panel. To adjust your video layout and screen view, select the view feature located in the top right-hand corner of your screen and choose the view that works best for you. At this time, I'd like to turn it over to Tina Barrett, Intellectual and Developmental Disability Team Lead for the Division of Mental Health, Developmental Disabilities, and Substance Use Services.
Good afternoon. We're so happy to see everybody here today. This is our Inclusion Works Lunch and Learn, where we will be talking about tailored care management and the tailored plan. We are very happy to welcome today Gwen Sherrod, who is joining us from the North Carolina Medicaid. She is a tailored care management. She will be providing an overview of the Medicaid system, as well as a tailored plan overview and talking about tailored care management. And we are also very happy to welcome Caitlin Law today, who is a care manager with the ARC of North Carolina, and she will be giving an overview of a day in the life of a care manager. At the end, we will have some time for questions and answers. Please use the chat box to include your questions and well as answer as many as we can. So Gwen, I'm going to hand it over to you.
Thank you for having me. Next slide, please. So I want to begin by just kind of talking about the North Carolina Medicaid system. So North Carolina's Medicaid system, delivery system consists of various components. The focus of today's conversation is tailored plans and tailored care management. So on these boxes here, we have our Medicaid managed care plans. We have North Carolina Medicaid Direct, which is not really a managed care plan, but it's our current fee-for-service system, which includes the LME MCOs for behavioral health and IDD services. And then we have tailored plans in the gold box, which launched on July 1 of 2024 for individuals with serious mental illness, serious emotional disturbance, serious substance use disorder, IDD, or TBI, or traumatic brain injuries. And then we have standard plans, which launched on July of 2021, which has the majority of the Medicaid population. And we have a new children and family specialty plan, which we launched a request for proposal in February, but we just awarded the proposal to Blue Cross Blue Shield. So they'll be handling our child and family specialty plan for children and youth currently formally involved in the child welfare system and their families. And we have the Eastern Band of Cherokee Indians, or ECBI, tribal options, which also launched in July of 2021 for tribal members and their families. It provides physical health and prescriptions through North Carolina Medicaid Direct and case management. Most individuals covered by Medicaid Direct will, may stay in may move to tailored plans. So let's move to the tailored plans overview. Next slide, please. So tailored plans are new for North Carolina. They are a new kind of managed care health plan. So they are a health plan. And they launched in July 1 of 2024. And the tailored plans offer coverage and service for people with more intense needs, including people with mental illness, such as schizophrenia, bipolar disorder, and depression, addiction to alcohol or drugs, such as opioids or cocaine, intellectual or developmental disabilities, such as Down syndrome, autism, fetal alcohol syndrome, and traumatic brain injuries, such as from car accidents, falls, and sports injuries. Individuals who currently get these services under Medicaid Direct may be moved to a Taylor plan. So essentially the name is changing, but the services are not. So Taylor plans, the idea is that they put members first. Members will get Medicaid services through their Taylor plan. This is a special health plan that offers access to a wide range of services to meet all of the members' needs. All of the health needs are covered in one plan. With the Taylor plan, all of the members' health care needs are covered in one place. This includes physical health, pharmacy services, mental health, help for developmental disabilities, brain injuries, long-term care, and other necessary health services. And they get support. Members that are in Taylor plans get support from Taylor Care Managers. And Taylor Care Managers help members get the medical or special care they need. They can set up doctor's appointments, arrange transportation, provide help with food support, housing, jobs, and more. So I want to talk next about the services offered by Taylor plans. Taylor plans are tailored for people with complex health needs who need long-term care, whether in a facility, at home, or in the community. Taylor plans offer certain services that standard plans don't have. And so I put a list of some of the common things that Taylor plans cover. So some examples are services that look like ACT, child and adolescent day treatment services. They include community support team, residential treatment facility services, substance abuse and medically monitored residential treatment, innovations, waiver services. So I'm not going to read all these because it's not an exhaustive list, but what I've done is, and because you'll get a copy of this PowerPoint, there's two links. One to talk about the Taylor plan services, and one just general benefits and services. So we just want to make sure that you get the full list. Next slide, please. So there are 4 Taylor plans who serve North Carolina. So the Taylor plans will be managed by the 4 existing local management entities, managed care organizations, or LME MCOs serving North Carolina. And the 4 are Alliance Health, and I've included their phone number, Partners, Trillium Health Resources, and Via Health. So how members can get a Taylor plan. A letter was mailed in mid-April informing eligible individuals which Taylor plan they're in. Taylor plan assignment is based on the county where the person gets their Medicaid benefits. So there are a couple of ways to get into a Taylor plan. So one, we auto-enrolled existing Medicaid members. Members who already have North Carolina Medicaid had their eligibility for tailored plans automatically reviewed. And I have a link here for the eligibility criteria. Members that were deemed eligible moved to a tailored plan will receive a new member health ID card and a welcome packet. So you would have gotten a packet from either via Trillium Partners or Alliance. And then we have a request to move to tailored plans for members who have mental health disorders, SUD, IDD, or TBI, support and they have support needs and believe that they're tailored plan eligible. The member or their providers can ask to move to a tailored plan by submitting a request form. And there is a request to move form, can be accessed online. That form can be filled out online, or you can fill it out and mail it in. Individuals, they may decline or refuse to enroll in a tailored plan or enroll in a standard plan instead. But there are some services that are only available in the tailored plan. So what's changing and what's staying the same? So what's staying the same is the plan covers the same services as before. If you were in Medicaid Direct, this includes IDD, TBI, mental health, substance use, care management services. Waiver and waitlist members keep their spots. So the innovations and TBI waivers can keep their slots. They can keep the same care manager. So if you were already receiving tailored care management under Medicaid Direct, they can keep their same care manager. So if you have existing relationships with tailored care managers, they will remain unchanged. So what's changing? The biggest change is that your providers must be in network. So as I said before, tailored plan is a health plan. So just like any other health plan, providers have to enroll. So as a member, your providers, your doctors, your specialists must be in the tailored plan network, or it's also called be in network to be covered. Members can keep seeing their current out-of-network providers until January 31 of 2025. So, and that does two things. That allows time for providers who may not initially have been contracted on July 1 to contract and become in network. It helps with continuity of care so that you can still, even if they're out of network, you can still see them until January 31 of 2025. The members must choose a new PCP if theirs is not in network. Members who did not choose a PCP in their tailored plan network will have one assigned to them. Members will have until January 31 of 2025 to change their PCP without cause. So you are able to, so essentially what happened was if you didn't choose one, we chose one for you. And if you want to change, you have until January 31 to change without, without any reason. Next slide. So if you're moving to a tailored plan, this is what you should do. One, the first thing is update your information. Make sure your address and contact details are current. You'll get important mail about your tailored plans, or you may get phone calls from your care manager. So we want to make sure that your address and contact information is correct. Secondly, we want you to know your plan. You should have received a letter from your tailored plan. It would have come from Alliance or Trillium or Partners or Via, so you know who runs your plan. Number 3, you can either choose or change your doctor. If you didn't pick a primary care provider or PCP by May 15th, one was chosen for you, but you can change it if you choose, if it's needed. Number 4, check on your doctors to make sure that your doctors and specialists are in your tailored plan. If they're not, tell your plan or ask for help finding a new one. And number 5, ask about your care manager. Tailored care managers can help you get the care you need, like setting up your medical appointments. So you want to make sure that you avail yourself of your tailored care manager. Next slide, please. So, this presentation is about Inclusion Works. And so I wanted to talk a little bit about why inclusion is important for people with disabilities. So we have some providers on here, we have some families, and we have some members. And so just wanted to make sure that everyone was on the same page about why inclusion is important. So inclusion means making sure that people with disabilities have the same chances as everyone else to take part in all parts of life. This helps build a fair society where everyone's unique qualities are appreciated and people with disabilities can succeed and make a real difference. Inclusion is closely tied to full participation, which is a right for everyone, including those with disabilities. So we want everybody to be able to participate in anything that they choose to participate. Next slide. And so we want to promote inclusion through inclusive activities. Encouraging inclusion involves a multifaceted approach, including promoting inclusive activities for those with disabilities. And here are some ways to promote inclusion for people with disabilities. So the first thing we want to do is raise awareness. We want to educate the public to raise awareness about disabilities and break down stereotypes, which is what we're doing today. We're raising awareness. We want to improve accessibility. We want to make sure that all physical spaces, including outdoor, including public and outdoors, are accessible to everyone. And number 3, we want to promote social involvement. We want to ensure community activities are inclusive to people with disabilities so everyone can participate. And the main thing that Inclusion Works does is support employment. We want to encourage the hiring of people with disabilities to boost their self-esteem and foster a more inclusive society. And we want to encourage inclusive education. And inclusive education systems ensure that children with disabilities can learn alongside their peers, promoting understanding and reducing stigma from a young age. And so workforce inclusion means creating a work environment where people with disabilities have equal opportunities to join, thrive, and succeed in their jobs. And so I want to talk about how workforce inclusion benefits employers. There was a study that companies that practice strong disability inclusion outperform their peers, on average showing a 28% higher revenue, double the net income, and 30% higher profit margins. And also workers with disabilities show greater stability in their jobs compared to some of the other workers. Workers with disability are happy to work. They want to be there on time. They want to do what they're supposed to do. So they're much more stable in their jobs. And also employers who support these workers become more invested in their success, helping to build additional networks and support systems. So employers who support or hire folks with disabilities give them additional networks. The employees that work alongside them become their friends become their confidants, become their biggest cheerleaders. And so that helps for them to have additional networks and additional support systems. So I just want to talk about some best practices for employment support. So you want to make sure individual readiness. You want to make sure that the individual that wants to work, that they really want to work. And it's not just what the natural support wants. We hear that all the time, that, you know, the person, the natural support wants them to get a job or thinks they should get a job, and it's really not what the individual wants. And we want to allow that individual to determine where they want to work and what they want to do. You know, it's not for us to decide that Johnny has to go work at McDonald's, but, you know, he might want to be a landscaper. So we also want to make sure that the job is compatible for them. Find a job that matches that person's skills, interests, and abilities. And because we want to ensure a reasonable chance of success. We don't want to set them up for failure. We want them to do the job or have the job that they want, but we want to make sure that they are successful. We want to also clearly define the person's roles and job expectations, responsibilities, and tasks so that they know what they're supposed to be doing. And, you know, that they understand. They're going to have a job coach, or they may have a job coach, but we want to make sure that they understand their role and what they're supposed to do and their responsibilities. And I think that gives greater buy-in and also helps with that greater stability. And we want to make sure that they have the essential skills and support. So we want to provide training and support in areas like interview skills and daily preparation for work. We want to involve the person, the guardian, the supports, and the employment site in the education process. So we want to make sure that everybody who's involved is educated about this whole process. We want to make sure that that person, their guardians, and the employment site really understand what it is to hire someone with a disability. Next slide, please. So I want to move into tailored care management because it kind of flows all together. Under the tailored plans, the care manager will kind of help coordinate some of the services for individuals. Next slide, please. So what is tailored care management? It's tailored care management, or TCM, as you may see it, is a free service from Medicaid. It pairs members with a person who knows the healthcare system. A tailored care manager is for people who have serious mental illness, a severe substance use disorder, intellectual and developmental disabilities, or traumatic brain injury. And how does it work? So it is a part of the member's Medicaid benefits. So tailored care management is a service available for tailored plan members and some of those in North Carolina Medicaid Direct. It's free and it's optional. It's a member's choice to use it. It can be canceled at any time. It's personalized help. The care manager works with the members to navigate the healthcare system and manage difficult medical issues. They can even help with basic needs like referring them for food and helping them coordinate transportation. Tailored care management are folks that know the system and support a member's health and well-being. They partner with members to develop a care plan to achieve the member's goals. So meeting your tailored care manager. If a member is eligible, they're matched with a tailored care manager based on their needs. So if you have a mental illness, you will be matched with a tailored care manager that understands behavioral health. If you have IDD, you will be matched with a tailored care manager that understands IDD or TBI. You know, you'll be matched based on your needs. The member can call their tailored plan or their North Carolina Medicaid Direct Plan and ask, who is my tailored care manager? And plans can provide them with the contact information for that agency. So if you want to change your tailored care manager, members can do this twice a year for any reason. To change more than 2 times per year, an approved reason is needed. For example, the provider moves to a different location. Members can call their tailored plan or North Carolina Medicaid Direct Plan, and the plans can help you find a match based on age, location, and or health issues. So how can tailored care managers help? Tailored care managers can help people get the care they need. They help members manage their health and well-being so they don't have to do it all by themselves. There are a lot of the healthcare system in North Carolina is a little bit complex. Medicaid, all of those things can be hard to navigate. So a tailored care manager can help you manage your health and well-being. So they can help you find a doctor or a specialist. They can direct you to housing resources. They can direct you to food and nutrition assistance. You say, I have more month than I have food. They can help you, figure out how to get additional food and nutrition support. They can help you coordinate rides to appointments. They can support you with, if you have a chronic condition like diabetes, they want to make sure that you get the medication you need, you get the doctor's appointments you need, anything that you would need to support, chronic conditions. They can help you with support groups and community activities. They can help you with your prescriptions and medical supplies. They support with hospital admissions, transfers, and discharges. So your care manager will get a notice that says you've been admitted to the hospital. They can go and check on you, make sure that you're okay, help with anything if you're being transferred to another facility, or if you're being discharged, they want to make sure that you have everything at home once you're discharged. They can be your direct contact for all things Medicaid. They can help you, navigate DSS and food stamps and all of those things that anything that would be Medicaid related. Next slide. But the one thing that you have to do is you have to consent for tailored care management. We can't provide the service to you unless you say, hey, I want it. You're automatically enrolled in it, but you don't have to actually you don't have to actually, take it. But if you want to utilize the service, you're going to have to provide consent. So a member's assigned care manager must ask for the member's consent for participating in care management. So once you have that care manager assigned, they're going to contact you and explain the tailored care management program. And then they will document in their data system that the member provided consent, including the date of consent. So you're going to have to say yes and say, yes, I do want tailored care management. So tailored care management work to give you personalized help. And I'm going to give you some examples. For intellectual and developmental disabilities, they can provide community-based support, give you information around independent living and respite care. help you with school or job supports, help you build your care team, and help with supported decision-making. For those with traumatic brain injuries, some of the things that care managers can do, they can help you find brain injury specialists. They can help refer you or help you find rehabilitation programs. They can help you find TBI support groups, help with independent living skills, school supports, and job coaching. For addiction recovery, care managers can help you find treatment programs, help you find support groups, help you find sober living supports, help you find therapists, help anything that you need after your treatment, and help with job coaching. For better mental health, tailored care managers can help you find support groups, therapists and psychiatrists, help you with your prescriptions if you're prescribed any, or if you need prescriptions, and they can help during a crisis, and they can also help you with job coaching and job resources. And tailored care managers can also help manage your chronic medical conditions like diabetes and hypertension. So if you have physical health or medical conditions, they'll help support you in that also. So if you have an issue and you can't seem to get the information that you need, or if you feel like you haven't been supported the way you need to be supported, you can, Medicaid has a reporting system called the Medicaid Ombudsman. And so I just want to talk about when to report to the Medicaid Ombudsman. The Ombudsman can help you find helpful resources on upcoming changes to the Medicaid program, including how to enroll, health plan information, and other places that you can call for help and important dates. So you should call the Ombudsman when you're not getting the care you need. If you have a question about a notice or a bill that you received, if you've already talked with your healthcare provider or health plan and have not been able to solve or resolve the problem, if you have questions about the complaint or the appeal process. And so for inquiries, concerns, and complaints, you can call the Medicaid Ombudsman at 877-201-3750, or you can reach them online at ncmedicaidombudsman.org. So we're really excited to have released a tailored care management toolkit just this Monday. And we wanted to be able to put out information that can help folks understand the healthcare system. And so we have created a PowerPoint presentation with essential details about tailored care management, one-page flyers personalized for different audiences, social media copy and graphics you can share on your profiles, email templates, and templates for newsletters, information about who is eligible and how to figure out if you're eligible for tailored care management services, and some common question and answers about tailored care management. Now, some of the items that we have are specifically for folks in the community to, can be used by folks in the community to help members and beneficiaries understand tailored care management. So if you are a provider and you want to send a newsletter, or if you have a newsletter and you want to send out some information about tailored care management, there's email templates and newsletter graphics. If you have a social media account as a provider, you can share information about tailored care management. And this will help the people that you serve. And so you can download the whole toolkit on the Medicaid website. on our Tailored Care Management page under Toolkit. And we also have something that is, I think, is really, really good. You can order some of these materials printed at no cost. There's a link. You'll get a copy of this presentation. There's a link to the order form. So you can request Tailored Care Management and Tailored Plan print resources so that you can order them and you can share them with other partners. We also have free bilingual flyers and posters for some of the bilingual posters won't be available until early September. So we encourage you to get Tailored Care Management today. It's available for Tailored Plan members and some members with North Carolina Medicaid Direct. You can call your Medicaid health plan, either Alliance, Partners, Trillium Health Resources, or Via Health. If you're not sure which plan you have, you can call the toll-free number here to find out your Medicaid plan. And you can also visit our website to learn more. There are answers to frequently asked questions available on our site at medicaid.nc.gov/tailored-care.management. We have a whole bunch of information. Well, all of this information is on the Tailored Care Management website. Next slide, please. So I want to take time to introduce our next speaker, Caitlin Law. She is a care manager at the ARC of North Carolina. And she will share her experience as a day in the life of a care manager for IDD working with individuals seeking employment. Caitlin, over to you.
Yes, hi. So yes, I'm Caitlin Law. I have been a care manager at the ARC. This upcoming January will be 2 years. So I've kind of been around since the beginning of Tailored Care Management. I will let you know I have some notes here because I could talk about this for hours and I really wanted to make sure I hit on the most important things. Obviously, every single day is different as a care manager. I have checking my emails every day. I'm doing home visits. I'm making phone calls, checking in. Definitely staying organized is important because, it's easy to lose track on maybe what someone needs. I need to see everyone in person a certain amount of time. So there's a lot of keeping organized. When I first started a couple years ago, it was a lot of engagement. So I was given a list of names and was just calling and explaining Tailored Care Management. Do you want to sign up? Once they confirmed and consented, then we would start the intake process, which is doing an assessment in person that takes about 2 hours. And then about a month later, doing the plan meeting. And that is what, so it takes about 2 to 3 months to kind of get everyone fully set up. And so now I'm in that great period where I have my full caseload, everyone's onboarded and set up. And right now I have 33 people that I'm supporting. My youngest is 4 years old and my oldest is 80 years old. So wide variety. And every person is different. So what's great about tailored care is it being tailored. So everything is individualized. And so that means too that every person I support has a different level of care need. Maybe some people just need that every couple months, me checking in, making sure they're doing okay, going to their appointments. And I have other people that call me every single day and they need me to see them once a week in person to help them out. So it's very individualized per the person's needs. Of the 33, only one person I am supporting has the innovations waiver. Everyone else, I have been working on onboarding them to get 1915I services, so CLS, supportive employment, and respite. So I think from January until now, I've gotten 30 people set up. So that means that all of those 30 people needed an additional assessment and an additional plan meeting and connecting them to the agency that they want for their services. And then we also are doing where we'll do the plan again on their birth month so that next year I don't have 30 plans to do in January. It'll be kind of more spread out. So I've done almost 2 to 3 plans for each person in 1 year, which won't be that way in the future, but that's what it looks like right now. And, you know, the ARC has always helped individuals that have disabilities, but with tailored care management, we're focusing more on whole person care. So on top of connecting them to community living supports, respite, and supportive employment, you know, there's a lot of other things on top of that that we're helping them with. Of my 33 people, more than half of them are living in poverty. So they might not have transportation. Maybe I have to help them get their power turned back on. I have a few that are borderline being homeless. A lot of them, their parents have IDD themselves. Maybe they don't have a computer, don't have internet. So it's really, before we can help them with employment needs, their basic needs need to be met as well. So it's a lot more than just the employment aspect. It's how do we even get you there? Because you need your lights on and you need clean clothes and you need to get to work. So it's kind of the whole person aspect of it to best support them. One example I want to give is in the very beginning, I was like, oh, I'm going to make these binders for some of the people I was supporting, and everything's in here. If you need assistance with diapers, this page tells you who to call to get diapers. This next page, if you need to make a doctor's appointment, call here. And while that might work for some people, I learned very quickly that that is not as supportive as it seems. So, you know, a lot of the people I support, making a phone call like that is a lot. And that information that they're giving on the phone call, maybe they don't understand, and it's hard for them to relay information to me. For example, I had one member that I saw in person once a week for 2 months, and that's what she needed. And, you know, I met with her landlord when she had questions. I helped her look over her lease. You know, she had issues with transportation, and there's always a lot of bumps, and it's a lot of brainstorming to figure out the puzzle, because the member, she has 6 kids, one of which is 9 months old. Well, okay, Medicaid transportation, she needs her own car seat. Well, she doesn't have a car seat. So now we got to figure out how do we get her a car seat. You know, even she needs to go to the dentist. I was calling around for dentists because they won't let the 9-month-old be in there with them. So you're trying to figure out, okay, daycare, we need daycare. Well, let's a voucher. So it's a lot of little steps to get to really complete and help people fully. I will say what's been awesome is the 1915I. Now that 30 of the people I support are connected, that one member who I saw once a week and talked to on the phone almost every day, I went almost 3 weeks without hearing from her because she had a staff in her home able to kind of help her and give her that support. You know, I will say now that the services are in place, I'm doing a lot more monitoring. So yes, we're going to connect you to these resources, but I want to make sure they're serving you as they're supposed to. You know, I want to make sure the staff is treating you with respect, that you get along with them, and know that if you don't like, you know, if a staff's treating you a certain way and you don't like it, call and tell me, because this is supposed to be serving you. And if they make you feel bad, then let's find you a new staff member. You know, we all know there is a staffing crisis right now, so that's been really difficult. Even that one member I was just speaking about, she actually has gone through 4 staff in, I think, 2 months. But even though there's been that high turnover and she hasn't found that perfect staff, just those couple days they were there really did help her a lot. So ideally, we want them to have staff that's consistent, and I kind of let them know it might take some time. You're not going to just meet one person and it maybe be the right fit. So just kind of being there to encourage and then support. I'll even say, I'll come the first day the staff's there, and that way I can support you and help you decide how you're feeling about them. There's anything that they need help on, I in some way can do the research, look up, figure out how can I help you. And a lot of times it's asking them, you know, is there anything I can support you with? And there's almost nothing that's off limits. I mean, there's definitely some barriers. And I did want to read, now we're getting into this whole person care of adding the medical portion. And so with tailored plan, I'll be honest, before I worked at the ARC, I did not have insurance. This is my first job with insurance. So I don't know a whole lot about it. So I'm having to do this research. I don't know. I'm very blessed to not have anyone in my life that has diabetes. So now I've got to inform myself about diabetes. So there's a lot of this independent work too during my day of learning about resources and learning about health conditions and what age does someone get a mammogram? I don't know that. So that was something I looked up because I'm not going to tell you to get it at 15, so it's a lot of background research to better your knowledge to support that person in any way. Along with medical, we do the Medicaid eligibility. So making sure, we kind of check for the next month and we kind of know ahead of time, hey, for some reason it says you don't have Medicaid next month. Maybe you need to do your reassessment, making sure they don't lose their insurance, checking in and making sure they're going to their annual physical, any doctors. Also, with barriers, I've helped someone get a free laptop so they could do virtual therapy because taking the bus and doing this, and then they were just not going to therapy. So there's always a lot of bumps that you have to kind of use your brain to brainstorm and figure out, okay, how do we get over these barriers to get you what you need? I was going to also suggest something that was a big eye opener for me is, medications. I had a few members where I would say, oh, are you taking your medicines? Yep, taking my medicines. And I was like, great. And I was like, oh yeah, they're taking their medicines. And I started realizing, I'm like, something doesn't seem right. Their A1C number was through the roof for diabetes. And I'm like, but they say they're taking their medicine. And the next home visit, I was like, hey, can you bring out your medicines so I can look at them? Half the bottles were empty. The other half were expired by 3 years. So that was a big learning moment for me of, okay, yes, we trust our members and we talk, but we need to go as far as, let me see your medications, because maybe they think I'm taking it every day, but it's been expired. So just really kind of going above what you might think the baseline role is to make sure these people, that they're healthy, safe, and also living the best life they can live. Going back to the diabetes, I know with my members, I believe I'm supporting 4 people that have diabetes and 5 that are pre-diabetic. We do have a nurse that works for the ARC that I was able to call. And so sometimes I make appointments with her and I can give specifics about an individual. She can look up their information and we kind of figure out a plan together. So even though I don't know a whole lot, I'm not a doctor, we do have a nurse for the entire ARC that I can make appointments with to kind of ask questions. We've talked about how it'd be wonderful to have a nurse or medical professional on every person's individual team. I mean, that would just be amazing. We don't have that right now. And I definitely put a big note that like the team mentality is best. I'm only one person and I can do the most that I can, but it turns into a lot of triaging in a way, which I don't like because, say if you want to find a new therapist, okay, I'm going to write that down. And if the next day someone's, getting evicted and they're going to be homeless, I have to make that the priority. But when we have a good team, I can say, maybe I can call the QP and say, hey, I have this big thing coming up. Is there any way you could maybe look into therapists? Do you have a list or something that would maybe help them out? That has really been the most helpful. And also with the team mentality being best and also the help with the services, I've had, the one member I gave an example of, the fact that she's not calling me every day is great because she has someone physically there with her. I have another member that he has diabetes and the staff that the QP found for him also has diabetes. He wants to get his driver's license and the staff used to be a driving instructor. So it's really great when we can find these people to be a part of the team that really are like the perfect match and can help with a lot of the trickier things. Because me as one person, I'm not going to be a master in everything. And I do have to research and that's great, but it'd be so much easier and more effective to have other people on the team that know these things as well. I do want to, obviously this leads into supportive employment. same thing, the best team that we have is the best way to help people with employment. The biggest service we have at the moment is supported employment, which gives someone, a staff member, a job coach, for a certain amount of hours a week, maybe help them get a job, prepare for the interview, and then also can be on the job site with them to help them learn the skills and then slowly fade out. And this is a wonderful service, but it's very niche group of people that it works 100% for. So that's when it goes back to brainstorming with your team. And I was on a call last week with a QP and someone else from a different agency about a member I'm supporting who really doesn't want staff, but they need help getting a job. And so, okay, how can we navigate this and jump through this hurdle to get him the help that he needs to get a job? Some other things that are hard is transportation. I mean, transportation is one of the biggest barriers getting to work. Also, these pre-employment skills, life skills. I taught for 3 years in high school adapted curriculum life skills class. And I learned in a training that the 4 big reasons that people with IDD get fired from a job are not knowing how to ask for help when they need it, not knowing what to do when their task is completed. So they've done a task and not really knowing what to do next. Being appropriate on breaks. So coming back on time, taking their break, not bothering other employees while they're still working. And then hygiene. So making sure they're dressed well, clean. And all of those are skills, along with social skills that have to be built to really be successful at work. So there's a lot that goes into it. I know also another hurdle is, say you have a felony and, what can I do as a care manager to help you get a job if you've had a felony in the past? Well, I could maybe look up a list of places in Charlotte that hire felonies, or maybe they don't have the felony check box on the background check. So really it's care manager, it's just brainstorming, working with the team, doing research to figure out how can I make these puzzle pieces fit and these barriers smaller for you to get over to get what you need to live a fulfilled life. Similar to the nurse, I think it would be really great in the future to have more of the job management team to be a part of the care management team. Your manager at your job should be involved. Maybe they should get the plan. They should know everything about you, So that's not something that happens yet. But also I think part of being a care manager is brainstorming, okay, this is what we have right now. How could it be better? And coming up with those ideas and making connections. And how, like I said, I could keep talking, but how I kind of wanted to end it is, I can be the best care manager I can be. I can be on it 100% of the time, do everything to a T, and there are still going to be limitations because of the resources that are available, maybe a wait list. Our world is not perfect. And sometimes that's me admitting that, and talking and connecting to families is also what they need. They need someone who knows them and cares about them and can say, this is hard and I'm really sorry you're going through this. I'm with you through it every day. It might feel like nothing's going on right now, but we're not going to give up. We're going to keep looking and figure out a different way. And I also did want to say, similar to the DSP staff, tailored care management is going to be the most beneficial if there's consistency. And these type of jobs, I'm sure we all know, there's a lot of turnover. And I put in big letters, avoiding burnout. I can't be the best care manager I can be, and I can't support you if I'm not taking care of myself. So maybe that means that I go to my supervisor and I ask for help, or maybe it means that I say, I don't need help, but can I cry to you about this for 5 minutes? And, I can turn my phone off at 5 o'clock, but I can't turn my brain off. There's times I'm laying in bed and I'm thinking about, I've had some pretty intense people, and you grow to really love and care for them. For example, I had a member that before I met them had attempted suicide, and they have scars and they cry to me about it. And, that's not something that when I turn my phone off, I'm just gonna be able to turn off. So just really getting emotional support, taking breaks, taking care of myself. And I am a very big advocate on therapy. I love my therapist. And what's great about therapists is they're in the mental health world. So when you talk to them about this, it's not breaking HIPAA, and it's, they understand it because they're kind of in the same boat that we are. They're trying to help people, and it's hard on yourself. And yeah, so I could keep going and going. The list is limitless on how we can support people. It's really just caring and getting to know your families, the members, and thinking outside the box to help them live the best life that they can live. That is all.
Thanks, Caitlin. I think Ashlyn's gonna kind of walk us through some Q&A, I think.
Yes, we have a little bit of time. Thank you so much, Caitlin. Really appreciate all of that information, and Gwen as well. I think there's so many questions in the chat, and unfortunately, I do not think we'll be able to get to all of them. We did try to answer some offline, and just to share, Caitlin, your experience. Thank you so much. As we share, we do not endorse specific providers, but really appreciate you being able to join us today and have just all of that helpful information. And I think just show quite the complexities of what it means to be a tailored care manager and do tailored plans. It means extra attention, extra work, extra details. And to your point, it can be really difficult to be able to balance all of that when you have multiple folks that you're caring for in that sense. So I wanted to open it up to see if anybody had any questions. If not, there is a specific, some that we got that I think would be really interesting. Sharing a little bit about if somebody can just kind of talk a little bit more about where somebody would go to look for employment opportunities and to find their care manager. I think we shared the importance of having access to your tailored plan, but just kind of discussing a little bit more about if there's any other recommendations for folks.
I would say a lot of the things that I do is, where do they like to go? You go to the comic book store every Wednesday and you like the staff. It's like, why don't you see if that's something, they'd be willing to hire on? Especially those places that they like and have already built relationships with. It is difficult. It's more of that brainstorming. I had a teacher once in college that told a story where there was a student who he wanted to be a pro wrestler. That's all he wanted to do. And she was like, okay, well, it doesn't seem very achievable, but why do you want to be a pro wrestler? And, he said, I love wearing the costume. I want to be on TV and I love wrestling. Mm-hmm. And so they're like, okay, well, I think he ended up maybe being in a car commercial for his uncle's car business. So he was on TV. He wore a costume in that commercial, and then he maybe took tickets at a wrestling event. So it doesn't have to be that you're a pro wrestler, but why, maybe if this is the job that you really want, like, what do you like about that job? Oh, I like that it's work from home. Oh, well, there's a lot of options that are work from home. It's not just maybe IT. It could be this. It could be, so kind of figuring out the why of maybe what they're wanting. Mm-hmm. And yeah, it's kind of just going that extra mile of maybe making the phone call yourself to kind of explain to these businesses, hey, this is kind of what's going on. Mm-hmm. And is this something you'd be willing to help with? There's really not a list that you could find that's easily like, hey, go to these places. Mm-hmm. But yeah, just doing that extra research to kind of figure it out.
Absolutely. That's super helpful. Thank you so much, Caitlin. And again, I know we are reaching time, so just wanted to, no, you were so fine. That was a great overview. We have all these questions. We'll work on pulling some of these together and potentially sharing some of the responses in a follow-up email to the folks who shared some of these. And again, there's really great resources. This presentation will be posted along with the presentation and the recording of this webinar for all of you to be able to access. And there's a transcript if you need to jump between the presentation, but wanted to thank you both again for joining us. I'm really grateful for the time we spent today. And again, thank you for sharing your experiences.
Thank you for having us.
Great.
Thank you.
Yes. The next Lunch and Learn will be in October, and we'll be reviewing more about employer benefits and talking about benefits counseling during that time. So hopefully you all will be able to join us.
Thank you, Ashlyn. The recording and presentation slides for today's event will be posted on the Inclusion Works website. The link is included in the chat. There will be a brief survey following today's webinar, and we would appreciate your time completing it. This concludes our webinar for today. Thank you for attending.